Hello, and welcome to this premiere episode of Doses of History brought to you by Bath Medical Museum. I'm James.
I'm Karen.
And I'm Honey.
We will dig into the strangest yet fascinating corners of medical history. Today, we examine one of the most infamous and misunderstood conditions of the Victorian age, hysteria. It wasn't just a medical diagnosis, it was a cultural obsession, a tool of control and a mirror reflecting a society's deepest anxieties about women, the body, and the mind. We delve into the facts and the myths of this maddening disease.
So, its origins. Imagine being told you were sick simply because you felt too much, spoke too loudly, or wanted something different from what society expected. That was the fate of many women throughout history, shaped by a curious and troubling idea that began in ancient Greece. Yes, Plato believed a woman's womb could become restless. He imagined like the womb of a woman becoming a creature inside and moving all around the body, especially if the woman did not marry and did not have any children. So this so-called wandering womb was blamed for everything, from anxiety and fainting to desire and defiance. But long before that, when people lived in close-knitted tribes and illnesses were treated with plants and ritual, it was understood that women moved through emotional physical phases each month, from one menstrual cycle to the next. These rhythms were seen as natural, even sacred, and were often linked to the waxing and waning of the moon. Today, science confirms what ancient healers already sense. Hormonal fluctuations throughout the menstrual cycle affected mood, energy, and brain chemistry. Yet, somewhere along the way, the wisdom was forgotten, or worse, twisted. By the 18th and 19th centuries, hysteria had become a catch-all diagnosis used to pathologize women who were too emotional, too sexual, too outspoken. It wasn't medicine, it was control. And behind it all was a fear, not of illness, but of women of power. So, Honey, tell us about the symptoms and triggers.
So, as Karen said, one of the main themes here is control. As you will see throughout the rest of this podcast, all three of us will be referring to control, as that was overall the aim of diagnosing women with hysteria. The symptoms of hysteria, the reasons why they would be diagnosed, was fainting, anxiety, insomnia, irritability, and excessive emotion. There were many more. However, these were the common symptoms. So these symptoms were often seen as a response to middle or upper class women's nervous lives. It could be also a response to emotional repression or a lack of intellectual stimulation. There's a book by Jane M. Usher, who's a senior lecturer at the University of Western Sydney, and it's called The Madness of Women. And in this book, she references the symptoms of hysteria. She referenced Elaine Showalter, and Showalter argued that hysteria is in many ways synonymous with femininity, with its unstable repertoire of emotional and physical symptoms. So these including fits, fainting, vomiting, choking, sobbing, laughing. So Showalter maintains that if the hysteric was mad because she was ultra feminine or too feminine, that could occur as well. So many women were positioned as mad also for not being feminine enough and not being a paragon of domestic virtue or failing their role as a wife or a mother. So this links to social expectations in the 18th and 19th centuries, which included expectations of marriage, chastity, motherhood, purity as well, big purity culture. So it was often diagnosed hysteria was in middle and upper class women who lived in tightly controlled, emotionally repressed lives. Any feeling that would seem too intense or inconvenient, feelings that we all feel today, men and women, would then be diagnosed as hysteria and would be treated as such, which James will lead on to in a second. In many cases, hysteria became a medical label for the psychological toll of being confined by rigid social expectations and denied a voice, a purpose, or simply the freedom to feel. So these were the symptoms. Then it would be diagnosed as hysteria. Then we lead on to the treatments and cures, which James will lovingly elaborate if he can read his handwriting.
Of course, I can do that. Yeah, so I'm gonna take you through some of the treatments that they used for hysteria. Now, first and foremost, we need to talk about a myth, and it is a myth that has permeated film, documentaries, books. It's been in academic articles, and it is a myth that has been taken as fact. If you go onto Google, in fact, don't do it now, watch this first. If you go onto Google and type in hysteria treatments, the first thing that will pop up is on the top of the page will be the AI section. And in that section, you'll see it cited as one of the first treatment listed. And that is that doctors would masturbate women to cure their hysteria. Now, specifically, it was you'll see it said that it was a standard medical practice that doctors would either use their hands to stimulate the clitoris or an electric vibrator. Later on, it would be electric vibrators, and that in fact electric vibrators were specifically invented to make this treatment a little less taxing for the doctor because doing all that work, sometimes it would take up to an hour with with the doctor's hand. Madness. They must have been exhausted. Carpal tunnel the lot. And then the electric vibrator was invented specifically so that the treatment could be performed in, less than 15 minutes. It's a myth. It's not documented anywhere in the literature from the Victorian age, and there's no evidence to say that it was performed or that it was a standard medical practice. And in fact, it was advised against to go on those areas and to perform massages. There's a source from 1907 from Charles Noble in a volume of the Gynecological and Abdominal Surgery. He says deliberate seances of the pelvic massage may lead to sexual excitation. 10 years later, James Craven Wood, a gynecologist, wrote the greatest objection to vibration is that it can be applied to overly sensitive patients and it is liable to cause sexual excitement. Where does this myth originate from? We got to go back to The Technology of Orgasm by Rachel Maines. It was published in 1999, and she argued that doctors stimulated the clitoris to bring a woman to orgasm. I won't go through it now, but there is a very interesting paper on this book. The book has largely been discredited now. In 2018, there's an academic article from Haley Lieberman and Eric Skatzberg. They read the book and thought something wasn't quite right, and the title of which is A Failure of Academic Quality Control, The Technology of Orgasm. If you want to know more about it, go to that article. It is a fascinating read, and they go through all the sources that Maines uses in her book and explain why what she's saying isn't correct. So, there you go. Bit of myth busting. Love it. Now, the real treatments. Vibrators were used, and they were used internally, but not to achieve orgasm. The concept of it, as we have heard, is that the womb wandered around the body, and when it wanders, it causes all kinds of mayhem. And the treatment to do with, especially with pelvic massage, that was a very common treatment. It was all about trying to move and reposition the womb back into its rightful place. Pelvic massage was performed largely on the abdomen, so externally, And sometimes it was performed internally as well, where two fingers would be inserted into the vagina and um, they would lift the upper wall of the vagina up. And with the other hand, they would place it on the abdomen and gently massage it. So pelvic massage is still a common treatment even now for some things. It is, and that is highly evidenced and documented. Now, let's go on to more interesting treatments. The rest cure. This is by far probably the most controlling. So the rest cure was created in the mid-19th century by Silas Weir Mitchell. He believed that because the womb was out of order when it began giving symptoms of hysteria, that an atmosphere of order and discipline was needed to correct it. So his method was simply to bedbound the patient, or at least put them in a room and have them there for sometimes days, weeks, or even months at a time without leaving. They were not allowed to have any form of mental stimulation, so no socializing, no talking, no reading, and definitely no exercise of the sort to anything would stimulate the mind. No exercise, no walking, no running. Their diet would also be controlled. He recommends a diet of solely eggs, or if eggs cannot be tolerated, then just milk. And that would be it. During that kind of treatment, other treatments may be used as well. Just if should it be called for, it could be bloodletting, it could be massages, and the like. Interestingly, we know how kind of mentally taxing this treatment was because it was written about in a booklet called The Yellow Wallpaper, and this was published in 1913 by Charlotte Perkins Gilman. She herself went through this treatment. It was forced upon her by her husband, who was a doctor, and she was put through it for 3 months. And she is quoted in saying that during this time, she came so near the borderline of utter mental ruin that I could actually see over that line. So it was, in a sense, absolute control over a woman. She wrote the booklet and she creates this nameless female character who also goes through this treatment as a result of being diagnosed with postnatal depression. Charlotte escaped this treatment and indeed her situation by freeing herself from the marriage and casting aside Mitchell's suffocating advice. There's a book called The Morbid Emotions of Women, Their Origin, Tendencies, and Treatment by Walter Johnson. This lists a whole myriad of treatments from bloodletting, consuming mercury, strict diets, warm clothing to stave off the cold, fresh air, frequent long walks, all kinds of things. Now, from what I've told you already, it is pretty clear that there is no one treatment. A lot of these treatments counteract each other. Mitchell said no walking, no socializing. Now, this is saying frequent long walks and fresh air. And this is a common thing in hysteria and in the medical industry. No one knows what to do. Another cure is this is by far the most torturous, I think. The water cure. I'll put a diagram picture somewhere. And this comes from 1851, so pretty much the same time. And this is to stop hysteric fits. And it is quite literally what it looks like in the picture. Listen, I don't know about you, but if I had cold water poured on my head for 3 hours, I would damn make sure I was well the next day. Women were actually enthusiastic about this treatment. Hydropathy, it was called. It was because it rejected the regular methods of other physicians for treating female disorders and childbirth. It's amazing. So that was actually seen as more favorable than other treatments just because how the other treatments made them feel and what effect they had. Now, to end this segment and to bring it all together, I'm gonna talk about this another booklet. And this is a striking admission from a doctor who has done a literature review in a booklet. It's only about 25 pages long, small pages. And it's by A.F.A. King. And it's on hysteria, 1891 this is, so late 19th century, just gonna cross over into the 20th century. This is really after the treatments that I've spoken about. But he prefaces this with something very interesting. He says, the remarks I propose to present on hysteria in this paper are altogether unfinished, undigested, and immature. The ideas I have here put down are perhaps scarcely more than superficial suggestions that will certainly not bear rigid criticism. So even in 1891, he is admitting not only do they not know what hysteria really is, how it's caused, and how to treat it properly. He's saying that there is no one treatment, there is no one or two symptoms that is absolutely applied to every single case. Actually, the whole concept of hysteria is still completely unknown. Their knowledge has not progressed. However, he says, in this booklet, I will write down and tell you what we do know, or what we think we know, and what we think can help. And some of the things he puts down are, the first thing is marriage. I thought that was incredible. Now, you're probably thinking, well, how does getting married solve anything? Well, marriage back then was more than just a ring on a finger. Marriage was a contract, really. It was to say that you were going to be with this person, you were going to be faithful, and more importantly, you were going to bear children. The concept of the wandering womb is that a lot of the symptoms are caused by it wandering and getting restless. It was believed that if a woman was to be married and bear children and use the womb for its intended purpose, then it would actually satiate the womb, bring it order and comfort. If you're watching, let me know what you think on that. You know, does marriage really help with mental disorders? Some might say it makes them worse. And of course, narcotics and alcohol. The standard in 1868 recommended chlorodyne. That contained opium and chloroform. It was a pain relief, but it was also a sedative to calm the nerves. Well, you'd feel good after that, though, wouldn't you? And of course, intellectual and muscular exercise. They were kind of on the right lines. They were getting there. They knew that walking was good for you. They knew that controlling diet to a certain point was helpful. But hold up, there is good news. After all of this, after all these treatments, and after all this doom and gloom, you cannot, or at least it's very rare, to die from hysteria. But if you take away anything from this section, is that there is no evidence to suggest that doctors were masturbating patients. And that's it. Thank you.
As you were mentioning some of the treatments that were happening, the cultural impact of hysteria and its diagnosis is worldwide.
Mm.
Hysteria itself, the word comes from the Greek, which means uterus. And that's basically why it was, when Plato said it was a wandering womb going around. So imagine being a woman in the 1800s and you speak your mind. Maybe you want you want something else than embroidery or a polite dinner conversations, and suddenly, boom, you're hysterical. They didn't have a proper diagnosis. They would say, well, she's hysterical. So if you were heartbroken, it was hysteria. Your refusal to agree with your husband, hysteria. Straight to the asylum, please. As you mentioned in Paris, they paraded you around, I'm sorry, my French, Salpêtrière Hospital, like a slideshow act under hypnosis. In the US and England, in the US, there was Elizabeth Packard. She was a very activist feminist of human rights, of women's rights, more than human rights, women's rights. And because she didn't agree with her husband, guess what? She was put into an asylum. And the same thing happened in England as well. If women had their opinions and men felt threatened, it was a medical condition. It was a social control dressed up as a lab coat. And even though the term has been retired, it goes to still whispers today every time a woman is told she's too emotional or overreacting. And I have to say, I grew up in Latin America, and every single woman I know, including me, we were told we were hysterical at one point or another. We were or too emotional, or we cried too much, or was overly sensitive, or we needed to keep more silence and not to speak up that much. So this is not that far away, but the word hysteria is still being used. Although Plato was right that it was related to the uterus, but hormones are actually, at least what I know at this point in life, they are managed in the brain. But the hormones are the ones that control our mood, our stamina, and all those things. So it's interesting that in a way they were right in the sense that they could, okay, it's the uterus that's something happening here, but they didn't know how to handle them. But because they were men and they did not have a uterus and they didn't know what to do, of course, it was easier to just categorize us and say, okay, we're hysterical, there's nothing to do right now. So the cultural impact of hysteria has been deep and is still very deep nowadays, I think. The good thing for me, at least, doing all this research we've been doing about this topic is that, well, guess what? I was not crazy. I was. This is who we are, and as women, we need to have all these ups and downs because this is the way we create life itself.
Just very quickly, when you mentioned how people are kind of still calling women hysterical now, there's actually a great parallel because we still call, or at least sometimes, maybe not so much now, but when you encounter like a really kind of strict or kind of evil woman, you would call them a witch, right? She's an absolute witch, right?
Or a
I've heard
Karen.
or Karen now. Yeah, it's a Karen now. Before that, before that though, it was definitely you would use the term witch as an
Mhm.
insult towards disagreeable, evil women. The reason why is because, of course, it was all about the witch trials way back, and the fact that that term has been used ever since the late 1600s is testament to how long it takes for something to really come out of like a societal norm. That two separate terms used to demean women are still carrying on. It's still kind of with us in society.
Well, and it's interesting that Hani mentioned Karen, in TikTok, you see, oh, here we have a Karen.
Yeah.
Now I see it is so funny because I've been categorized as a witch because
Yeah.
I read tarot cards and I'm very good in energy reading and I do a lot of holistic work. Being called hysterical a lot when I was growing up because I always tried to voice myself. And I'm kind of person that as you know me, I say things up. When I see
Mhm.
something, I just say
Very
it out
straight
loud.
talking.
Yeah, I have
Yeah.
no major filters. And now every time I see a TikTok and they mention, oh, here we have a Karen, guess what? I represent the three categories.
I wouldn't I
And
wouldn't I would def
I didn't realize that until right now. So, but anyway, I am happy about it because I am an advocate to speak up. So, yes, I'm proud to be the three
Yes,
aspects
Karen.
of life.
I mean, I wouldn't necessarily categorize you as a Karen in the TikTok sense, but yeah, go man.
You
You
go
you do
in.
you. You do you. You go Karen for the Karens. Okay, Sally, do you want to introduce yourself, please?
Yeah, so hi everyone. My name is Sally Frampton. I'm a research associate at the history faculty at the University of Oxford, where I specialise in the history of medicine.
Amazing. Welcome.
Thank
Um,
you.
so I'm going to preface this with something that I found, and then I'm going to hand it over to you. This is from an American doctor from 1891, and he writes this paper, and it's basically a literature review of what other medical professionals have written about hysteria and their experiences with the patients. But his introduction into it is it told me a lot. The remarks I propose to present on hysteria in this paper are altogether unfinished, undigested, and immature. The ideas I have put down are perhaps scarcely more than superficial suggestions that will certainly not bear rigid criticism. So, Sally, tell us what's going on.
Yeah, quite a lot, and thank you for that article. I mean, I think so. So in the history of medicine, we often use the concept of framing disease as a kind of starting point. So really, always thinking about diseases as having a biological essence, but having a social and cultural essence as well, or a social and cultural characteristic. So I think hysteria is a really good example of that. And it also shows us, I think, how fluid it is as a concept, that it's very difficult, as you've probably already seen, to kind of pin down a definition of what hysteria meant at any given time. There was a lot of contention around it as a concept, and the idea and meaning of hysteria was changing all the time historically. I think you mentioned treatment as something you were particularly interested in, James. So
Yes,
I
yes,
can I
very
can
much
say
so.
a bit about that. I mean, part of the confusion is because there was just myriad treatments used for hysteria. So your article is from the 1890s, and really we can think of like the late 19th century as kind of almost sort of a high point in the craze around hysteria. So the concept is a lot older, and we can talk about that. But in the at the end of the 19th century, you're seeing a lot of different ideas coming together, and a lot of that is because the ideas around gender and sex are also changing as well. So this idea of men and women having is very kind of essentialist framing of men and women having very different kind of sexed bodies, and people really trying to figure out where this kind of idea of where this kind of collection of symptoms of hysteria is actually coming from and what's causing it. And I mean, the symptoms themselves are not very stable. So generally, it's this idea of kind of agitation, nervousness, you're over emotional. Often there's a lot of physical symptoms in the case reports, that you lose power of your body, you lose power of your limbs. Sometimes it was combined with sort of ideas that we would now think of as epilepsy, that you might have seizures, that there's lots of rapid breathing, all these kind of huge collection of symptoms, but really every case was different. What kind of happens in the at the end of the 19th century is you have a lot of different biological concepts coming into play. So you have these changing ideas of gender. So this idea of the womb and also the ovaries is still very pertinent, that it has kind of a control over you if you're a woman somehow, but it's also clashing with new ideas about neurology coming in as well. So people like Charcot, who was at the Salpêtrière Hospital in Paris, he did a lot of work on hysteria, and he kind of posits it as a kind of neurologically based illness. But that doesn't really mean the old ideas go away. And in fact, like I said, you get these new, very gendered ideas about the uterus and the ovaries and the influence they can have over one's mind, personality, character, and illness. So, in a nutshell, there's a lot going on at this time, and hysteria really becomes a sort of focal point for lots of these bigger ideas happening in medicine and science.
That's interesting. He says and one of the treatments is oophorectomy. Oophorectomy, is that? Yeah,
Correct me. You correct me.
yeah.
That's a very important point because that's the other thing coming into play is surgery in all of these discussions. So surgery is not so much in play as a kind of treatment for these things before this period of time. But with things happening with anesthesia, with antisepsis, all these kind of things, surgery is beginning to be used more and more for major operations. So you have procedures like ovariotomy and oophorectomy to remove the ovaries or part of the ovaries being used. Mainly, it's been used to treat things like ovarian tumours and cysts, but some doctors start to use these procedures to try and treat things like hysteria as well, particularly in America, but not exclusively in America. So it's interesting that one other thing you see is even though hysteria is connected sort of linguistically to the womb, actually a lot of the interest is in the ovaries by the end of the 19th century as the kind of seat of potential disorder and things like that. So you have a guy in America called Batty, great name for a surgeon doing very dodgy
Brilliant.
operations, who does start trying to remove ovaries for people who have things like hysteria, epilepsy, and other kind of conditions as well. So yeah, surgery is also part of the of this kind of clashing of ideas and practices.
Alternatively, he suggests that marriage can treat this because the woman would get married and bear children, and that would somehow satiate, the ovaries and the overall problem. Is that is is there any proof behind that?
Yeah, definitely. So, I mean, I think that's the other piece of the puzzle, isn't it? We're kind of coming back to those social cultural kind of concepts as well. Lots of ways we could read hysteria might are arguably not about biology or illness at all, but about gendered expectations and, the idea of what it would be to be normal in this kind of period of time as a woman. And obviously, marriageability, producing children are all kind of part of that package of sort of, Victorian expectations. So there is that kind of moral aspect as well. Again, it's sort of seeded in some of the biological ideas. So you can go right back to Galen and when he was sort of talking about hysteria, and he talks about how, if there's an excess of if female seed is not expunged, and that can cause hysteria. So there's already these kind of connections forming between sort of sex and illness and all these kind of things sort of happening as well. So that sort of goes right back, these ideas about, managing sexuality, managing femininity, and all those kinds of things as well. But I mean, it's probably important to recognize that doctors really differed as they always do about these things. So for one doctor, you might have marriage as a suggestion or moral therapy or something like that. Another doctor might disagree with it. But yeah, I mean, this is very much part and parcel of it. And, again, we can think about another layer, which is the history of psychiatry and things like that. And, women who were not performing to the social standards, ending up perhaps in these systems because they were not conforming to those expectations. And it then becomes labeled as a disease.
He questions hysteria. He questions what they know, and he deliberately says that number one, if hysteria is coming from the mind, should we even be calling it a disease? And number two, you can't pin down a definition for hysteria any more than you can do a fever, because it's just a symptom of something.
Yeah, yeah. I mean, I think you're right. We can often sort of, and this kind of comes back to these legacies. We can paint a picture of, these doctors as all villains, and obviously there was some very
Of
inappropriate
course.
and unpleasant things going on, and we don't want to forget that either. But a lot of them were really trying to figure out actually what this category meant. And it was a very contested concept, even within its time, I think. And I think within that as well, you can sort of see the beginnings of what starts to be articulated by people like Freud, I guess, sort of at the beginning of the 20th century as this is a condition of the mind, rather than anything else.
It's interesting that you mentioned that because hysteria, it's 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 a word that's been used for over 2,000 years, and still now there's not a proper. It's not really a diagnosis. I'm a
Mm.
therapist, I'm a psychologist, and I also have master in spiritual psychology. And it's interesting to see how, in different cultures around the world, especially during the 19, 18, 19, and 20th century. I grew up in Ecuador, and still now, when women are have we have our emotional, because it is proven that women, we have 4 different phases during the month. And even though this was known by ancestral tribes, that women will evolve with the moon and evolve with the seasons as well. Of course, science just put that aside. But it's interesting because I remember growing up, it's not that far away, people will say, she's hysterical, don't pay attention to her. Or if I was having some kind of emotional outburst out of frustration or whatever, because we as women, we do have these changes. That's reality. Of course, nowadays, scientists say the hormones are produced in the brain. Others say it's produced in the womb. So even though, there's so much unknown behind the word hysteria, at the same time, there's lots of things that can be relatable. And in some parts of the world, the word is still used. And in other parts of the world, of course, there's a taboo in using the word itself, or people don't really want to investigate or pay that much attention to that.
Yeah.
So
That brings us swiftly onto the legacy. Sorry, yeah.
No, so it's a great point. I think, and like you say, because I think there's the other kind of terms came into play, like neurasthenia, because people were like actively avoiding those kind of categorizations. But no, I think you're right. And, sort of public perceptions and language kind of lags behind, even though I think, hysteria kind of came out of the DSM maybe 40 years ago, which is not that long ago, 40, 50 years ago. We still use the word, right? And in a way that's, demeaning to women. So yeah, very, very interesting point.
Is there still a prejudice between men and women in the doctor's room?
Yeah, I know
Yeah.
it's probably my nutshell answer to that. I mean, there's probably lots of different ways you could kind of approach that question. But yeah, I
Yeah.
mean, I think we know, you can think, for instance, so there was a whole controversy around mesh that was used to treat certain gynecological conditions a few years ago. And there was a big report by Baroness Cumberledge about that. And kind of what she found was, there's definitely a lot of gaslighting still kind of going on. And this isn't just gendered, it can be racialized and all sorts of, other kind of things going on. But, I think there are still those legacies, levels of distrust maybe, and, gynecological and obstetric care might be one place where it's a kind of lightning rod for those discussions, but I'm sure it goes on in other places as well. And, I mean, I think, if you look at the British Journal of Psychiatry in the 70s, they're still using hysteria. It's not exclusively gendered. That's quite an important point, even though it's predominantly seen as a female disease and it has kind of female roots. The idea that there was male hysterics was present and was talked about from the 19th century. So again, there's a bit of nuance to kind of these
That
discussions. But
that's interesting because
yeah.
19th century papers I've seen actually they say it's even more prominent in men than women that they've seen. So men can suffer from hysteria and they knew this.
That was how they described it, yeah. So definitely, if you look in a medical journal in the 19th century, you'll see, I think it was still considered something
Yeah.
different. So it's interesting in that males could be seen to suffer from it, but it was still sort of seen as a predominantly female disease in many ways. But then, of course, when the First World War happens, that kind of reignites conversations about men and sort of, I suppose, mental health generally, and the idea
Shell
of sort of
shock.
neurosis, yes, shell shock, and all those kind of things as well. So that in itself has quite an interesting history.
I was just thinking, we kind of came to the theme of control over women's bodies a lot throughout the last recordings that we did for this. When you're doing your research, particularly with surgery and things like that, does that come up a lot? Say 18th, 19th century, obviously in other ones as well, but is that a common theme throughout your work, or is it not touched upon as much?
Yeah, no, it's a great question, and so many ways you could kind of go around it. I mean, I think sort of one bit I would see as key to that is the question of consent, female patients' consent in this. That one of the real challenges of being a historian of this time is not necessarily being able to get first-hand accounts from women. So it's often you're reading it through like the lens of the doctor, and so you kind of have to take a pinch of salt of was consent really there. And sometimes they're very open that the consent is taken from the husband first rather than the woman. So I think there's absolutely elements of control kind of going on. There's some very high profile cases of women sort of being sent off to psychiatric hospitals because they were kind of considered bothersome really, to their husbands. So it's all, as Karen mentioned as well, kind of in this overarching patriarchal construction of the medical profession. Again, there's nuance to it, and women are obviously coming into the medical workforce sort of at the end of the 19th century, though, so that's kind of sort of changing things again. There's class dynamics. If you're a wealthier woman, you probably had more control, although doctors didn't particularly like that and saw it as a bit threatening, that nonetheless you would maybe have more control. But certainly if you're a woman from one of the poorer classes, you would have relatively little say over your medical care.
That definitely still happens. The women with less in a lower class, they have less saying about their medical condition than women in the higher class as well, because the access to medicine and doctors is completely different. So yeah, it's sad, but it still happens.
Yeah. I mean, there's one example I wrote about, which is a woman in I think it was the 1880s or maybe early 1890s, who went in to have an operation and explicitly said, do not remove both my ovaries, whatever happens. I'm engaged, I want to have children, all these kinds of things, whatever happens, don't do that. What happens in the operation?
Oh, no.
They're both removed, and we only know about this case because she was a nurse, so she was quite well educated, and she was educated on sort of health matters and things like that. And she took the case further into a sort of the legal territory, although she didn't win the case. So, kind of coming back to Honey's sort of point, I think that's an element where that control was articulated so tangibly upon this woman's body without her consent. So that's just one example, but I'm sure there are many more.
They would go to doctors. Usually, when they are poor, women who are poor, they tend to have more children. And the government on that time decided that they were gonna, do the procedure for women to have any more children, because it was becoming, when poor people have a lot of children, usually it becomes other kind of issues, social issues and all kinds of things. So the government just decided, without telling the women that they will, they would have some kind of disease, whatever, and they would go ahead and take their ovaries out or do the ligament, how is it? I don't remember the name right now, but for women not to have any more children, and that's the way they start control without telling the women. And they realized that something happened, because after that surgery, they couldn't have any more children. So, and that became quite a very well known, at least in South America, and the government, of course, had lots to say about that. And some government officials went to jail and all that stuff. But yes, it's interesting how that control still happens, regardless of how much information we have available nowadays. And yeah, it's still happening.
Let's stop there. That's thank you very much, Sally. You've been amazing. And so there we have it. The first episode of Doses of History, brought to you by Bath Medical Museum. We've had great fun making it, and we can't wait to bring you the next episodes as well. And just before we end, please enjoy the very first outtake of Doses of History. Bye-bye. Hysteria. I got it. Method acting now. They're having an episode right now.